Stepping in where human should not, robots are being used for jobs such as sanitizing hospitals and delivering food and medicines in many parts of the world, and perhaps soon in India, where the experiments are underway to increase the role in combating the COVID-19. As the coronavirus emergency exploded into a full-blown pandemic in early 2020, forcing countless businesses to shutter, robots-making companies found themselves in an unusual situation. Many saw a surge in orders. Robots don't need masks, can easily be disinfected, and of course, they don't get sick. And for this reason, an army of automatons has since been deployed all over the world to help with the crisis. They are monitoring patients, sanitizing hospitals, making deliveries, and helping frontline medical workers reduce their exposure to the virus. Not all robots operate autonomously. Many in fact require direct human supervision and most are limited to simple repetitive tasks. But robot maker says that the experience they have gained during the trial by fire development will make their future machines smarter and more capable. This photos illustrates how robots are helping us fight with the pandemic and how they might be able to assist with the next one. Troy team, a squad of robots serves as the first line of defense against person-to-person transmissions at medical centers in Kigali, Rwanda. Patients walking into the facility get their temperature checked by the machines which are equipped with the thermal cameras atop their head. Developed by UV Tech Robotics in China, the robotics also use their distinctive appearance. They resemble characters out of a Star Wars movie to get people's attention and remind them wash their hands and wear masks. There is a one more robot called Say Ah. No, I am not saying. The robot is saying Say Ah. To speed up the COVID-19 testing, a team of Danish doctors and engineers at the University of the Southern Denmark of Lifeline Robotics and developing a fully automated swab robot. It uses a computer vision and a machine learning to identify the perfect spot inside the person's throat. Then a robotic arm with a long swab reaches into and cut done with a swiftness and consistency that humans can't match. One of the creators puts his neck on the line to demonstrate that the robot is safe. The another one is John Zabo. After 6 of its doctors became infected with the coronavirus at the Sassari hospital in Sardinia, Italy tightened its safety measures. It also brought in the robots. The machines developed by the UVD robots use a LiDAR to navigate autonomously. Each watch carries an array of powerful shortwave and ultraviolet C light that destroys the genetic materials of the virus and pathogens after a few minutes of the exposure. Now there is a spike in the demand of UV disinfection robots as hospitals worldwide deploy them to sterilize intensive care units and operating theaters. Now let's talk about running errands. In the medical facilities, an ideal role of the robot is taking over the repetitive course so that the nurses and the physicians can spend their time doing most important tasks. At the Shenzhen Third People's Hospital in China, a robot called Aimbot rides down the hallway enforcing the face mask and social distancing rules and spraying disinfectant. At a hospital near Austin, Texas, a humanoid robot developed a diligent robotics fetches supplies and brings them to the patient's room. It repeats the task day and night tirelessly and allows the hospital staff to spend more time interacting with the patients. Nurses and doctors in a Circolo hospital in the Paris in the northern Italy, the country's hardest hit region, used as the robots as their avatars, enabling them to check on their patients around the clock while minimizing exposures and conserving protective equipment. The robots deployed by the Chinese firm Sandbots are equipped with cameras and microphones and can also access patients' data like blood oxygen levels. Telepresence robots originally designed for an office are becoming an invaluable tool for the medical workers treating highly infectious diseases.
What a noob.
Highly infectious diseases like COVID-19, reducing the risk that they will contact the pathogens they are fighting against. The help from the above. Authorities in several countries attempted to use the drones to enforce lockdowns and social distancing rules, but the effectiveness of such measures remains unclear. A better use of drone was for making deliveries. In the United States, startup called Zipline deployed its fixed-wing autonomous aircraft to connect two medical facilities 70 km apart. For the staff at the Huntersville Medical Center in the North Carolina, masks, gowns and gloves literally fell from the sky. The hope is that the drones like ziplines will one day be able to deliver other kinds of critical materials, transparent test samples, and distribute drugs and vaccines. But the robots are no stranger in the healthcare system. In the 1980s, robots evolved from being used for only industrial use to assisting in the intricate and often complicated surgical procedures. Today, the use case in the healthcare are much broader, with robots for cleaning, delivering and dispensing medications, providing a companion, or lifting a patient out of the bed. And now robots are being used to deal with the contaminants of the coronavirus.